Residents of Paramakatoi and the surrounding communities are set to benefit from an improved quality of healthcare. This was made evident as Minister of Health Dr. Frank Anthony recommissioned the new Paramakatoi Health Centre, which was retrofitted to a smart hospital, on Saturday morning.
We have embarked on a project to transform the health sector in Guyana. And you would have noticed that over the last 2 years or so, we have placed a lot of emphasis, despite the challenges that we've had with COVID, we have placed a lot of emphasis on developing, strengthening, expanding the range of services that we can offer at any one of our health facilities. And here is no different, because we think that we need to expand the range of services that we can offer here.
Dr. Anthony noted that the hospital will not only bring improved services to the people, but will do so in a modern, resilient facility that is easily navigated.
One of the challenges that we've had with existing facilities is that over time we keep adding pieces and pieces to it, and after a while they become very cumbersome. When people come, they're not sure where to go, which room to go in, and sometimes it can be challenging, especially for older patients. So part of this project is to simplify the layout of the building so that when people come in, they can have easy and ready access to the building.
So the idea of this project is to make sure we have really strong facilities that can really withstand the future. So it's about making them safer and about greener and stronger and more resilient healthcare.
This effort adds a very important layer or dimension to our collaborative work on health here in Guyana. Through this project, we have been retrofitting health facilities to become safe and resilient against various hazards such as hurricanes, droughts, floods, and earthquakes, to become more environmentally sustainable in terms of water, electricity, and power consumption, and very importantly, to improve the functional and operational capacity towards rendering good quality and relevant healthcare service to the people of Guyana.
Representatives of the Guyana Defence Force who executed the upgrades expressed pride at being able to contribute majorly to the development of the region.
The fact that the Guyana Defence Force was involved, we were able to bring our logistical expertise in terms of getting materials to this community. Like you know, everything in and out of this community is pretty much by air. We were pleased to have our Corps of Engineers under the leadership of Lieutenant Colonel Daniels, who brought the engineering expertise to fore at this location. And we were able to deliver this retrofitted facility, smart facility, to the community.
The Guyana Defence Force was of course selected because that's what we do. We move people, we move material, we move men around the country. As His Excellency would have envisaged, the role of the Guyana Defence Force has expanded to one of community partnership, and we see ourselves as a partner in this process in delivering this service to the people of Paramakatoi. So for me, it's a personal pleasure and privilege to have led the team that would have executed these works.
Not only community as in Paramakatoi, but we have other catchment areas, and mostly this health facility would have been like a referral where other smaller health facilities would have referred patients over here. So it's going to benefit most of the people over in the north because, for example, we have Red Creek, Mountain Foot, Bamboo Creek, Tusene, we even get patients from Taruka. So yes, it's going to benefit a lot of them.
I feel so glad of this commissioning of the Paramakatoi Smart Health Centre, because it will benefit the community more effectively than before, because we never used to had the solar the electricity in this health center before, and we used to have water shortages and so forth. And we have more nurses here in Paramakatoi Health Center. We never used to have more than one nurse.
It is a very good initiative, and I know that we're going to benefit a lot from it, because with the facility being not as it is, we had a lot of challenges we had to face, and we had to work through those challenges. We had to do a lot of improvising for beds and seating facilities and so. But now that seeing that this has been given to us, I really appreciate, and it's going to benefit us.